Gentlemen, let's talk honestly for a moment. Have you ever been in the middle of an intimate moment where everything feels good for you, but you sense your partner isn't quite getting there? Maybe she enjoys the closeness, the affection, the connection, but reaching orgasm feels difficult, inconsistent, or doesn't happen at all. If that sounds familiar, you're not alone, and it's not a personal failure. Research consistently shows that while most men climax during sex, a large percentage of women do not, at least not without very specific types of stimulation. And that gap can quietly create frustration on both sides. So here's the real question. Is there a way to significantly increase her chances of orgasm without awkward guessing, pressure, or endless trial and error? The answer is yes. And it's not about tricks or performance. It's about understanding female anatomy, blood flow, and positioning, something science has mapped out in surprising detail. Researchers using advanced imaging techniques like ultrasound and 3D modeling have shown that certain sexual positions dramatically increase arousal and stimulation, while others unintentionally miss the mark. Today, I'm going to walk you through 4 positions that consistently rank highest for female orgasm based on anatomy and real clinical data. And if you stay with me until the end, I'll also share a simple technique you can use in any position to dramatically improve the experience for both of you. And before we dive in, I'd love to hear from you. How old are you? And where are you watching from today? Drop your age and location in the comments. This channel is about men supporting men, and you'll be surprised how many others are navigating the same things you are. If men's health, intimacy, and honest conversations matter to you, hit like and subscribe. We talk about the things most people avoid, respectfully, clearly, and without judgment. Now let's clear up one of the biggest myths men have been taught. For decades, movies, locker room talk, and even bad advice have pushed the idea that if a man simply lasts longer, his partner will be satisfied. But biologically, that's just not how most female bodies work. The majority of a woman's pleasure receptors are located in the clitoris, which contains over 8,000 nerve endings. Many of those nerves aren't reliably stimulated through penetration alone unless the angle, pressure, and rhythm are just right. This isn't about skill or effort, it's about geometry and physiology. When positions fail to create consistent clitoral contact or proper blood flow, orgasm becomes difficult, even when emotional connection and desire are strong. That's why understanding positioning matters so much. With the right angles, stimulation becomes more natural, more predictable, and far more satisfying for her, without you having to perform. Now let's get into the positions themselves, starting with one that's often underestimated. The first position may not sound flashy, but it plays a far more powerful role than most people realize: sitting face to face. From a purely mechanical standpoint, this position provides moderate clitoral stimulation, but where it truly excels isn't just physical, it's emotional and neurological. When you're seated facing one another, eye contact, kissing, touch, and verbal reassurance happen naturally. There's no reaching, no disconnect, no guessing. And for many women, that sense of emotional presence is what allows the body to fully relax. Relaxation matters more than most men are ever told. Clinically, we see that when a woman feels emotionally safe and mentally present, her nervous system shifts out of stress mode. Blood vessels relax, blood flow increases more easily, sensitivity improves, and arousal builds in a smoother, more reliable way. In other words, emotional comfort directly supports physical response. That's why this position can be especially effective for women who struggle to climax when they feel rushed, pressured, or distracted. It slows everything down and creates a feeling of being fully seen and connected, which is often the gateway to deeper pleasure. To try this position, sit on the edge of the bed or a sturdy chair and let her straddle you. Keep your posture upright. Move slowly. Focus less on intensity and more on rhythm and closeness. Small movements, steady contact, and shared pacing tend to work best here. This isn't about speed or force. It's about staying present and connected. For many couples, this becomes a favorite position on nights when connection matters just as much as sensation. It builds trust, deepens intimacy, and often sets the stage for more intense arousal later. And now that we've covered a position rooted in emotional connection, let's shift to one that's far more physical: and one that research quietly but consistently supports. Now let's move to a position that's far more physical, and one that research quietly supports: the coital alignment technique. This position is often misunderstood because it looks similar to missionary at first glance, but the experience and the results are completely different. Unlike traditional thrusting, the coital alignment technique is designed to prioritize constant clitoral contact, not depth or speed. Here's what's happening biologically. In standard thrusting positions, stimulation comes and goes, pressure shifts, angles change, and clitoral contact is inconsistent. For many women, that inconsistency makes it difficult for arousal to build steadily enough to reach orgasm. With coital alignment, both partners shift slightly upward so that the base of the penis and the pubic bone maintain continuous, sliding contact with the clitoris. Instead of thrusting in and out, the movement becomes slower, more circular, and more synchronized. From a physiological standpoint, this matters because steady stimulation allows blood flow to remain concentrated in the clitoral tissue. Rather than resetting arousal with each movement, sensation builds progressively, which is exactly what most female nervous systems respond best to. Clinically, this position is associated with higher rates of orgasm, especially for women who don't climax reliably from penetration alone. There's also an important psychological component here. Because the motion is slower and more rhythmic, performance pressure tends to drop. The focus shifts away from doing something right and toward moving together. Many couples describe it as feeling less like a performance and more like a shared experience. To try this position, start in missionary, then slide your body slightly higher so your pelvis stays closely aligned with hers. Keep your movements shallow and intentional. Think gentle rocking rather than thrusting. It may take a few moments to find the right angle, and that's normal. Adjust together, talk, laugh if you need to. Once you find the alignment, many couples are surprised by how intense the sensation becomes without needing more effort. For women who need consistent stimulation to reach orgasm, this position often becomes a game changer. And next, we'll look at a familiar position, but with one simple scientific adjustment that dramatically increases its effectiveness. If there is one position that consistently shows the highest rates of female orgasm across studies, it's woman on top, face to face. The reason is simple: control. In this position, she controls the angle, depth, rhythm, and pressure. That alone dramatically increases the likelihood of effective clitoral stimulation. When she leans forward, her pelvis naturally presses against yours, increasing contact with the clitoris. Many women instinctively adjust their movement in small, precise ways that would be difficult for a partner to replicate. Studies measuring clitoral blood flow show that this position produces some of the highest levels of arousal, largely because the stimulation is continuous and customizable. But there's also a psychological layer here that matters just as much as the physical one. This position creates a sense of empowerment. She doesn't have to wait, guide, or hope you find the right spot. She can respond to her own sensations in real time. That sense of agency reduces performance pressure for both of you. You're no longer trying to make something happen. Instead, you're supporting an experience that unfolds naturally. Your role in this position is important. Stay engaged. Maintain eye contact. Use your hands to support her hips or back. Stay present and responsive rather than passive. Think of yourself as the anchor, steady, connected, and attentive, while she leads the movement. For many women, this position feels both physically effective and emotionally safe, which is a powerful combination. And when intimacy feels collaborative instead of performative, satisfaction increases for both partners. Now, no matter which position you use, there are a few universal principles that dramatically improve results, and these apply across the board. No matter which position you use, there are a few core principles that consistently make the biggest difference, and these matter far more than novelty or intensity. The first is angle. Small changes in hip position can dramatically alter which nerve pathways are stimulated. We're not talking about major adjustments. Sometimes even a half-inch shift in tilt can increase clitoral contact and blood flow enough to change the entire experience. When something isn't working, don't assume the position is wrong. Often, it's simply the angle. The second principle is depth control. Deeper isn't automatically better. In fact, many of the most sensitive nerve endings are located closer to the entrance rather than deeper inside. Shallow, controlled movement often provides more consistent stimulation than deeper thrusting, especially when paired with steady rhythm. This is why slowing down frequently improves results rather than diminishing them. The third principle is consistency. Female arousal tends to build progressively. When stimulation is steady and predictable, blood flow remains concentrated, sensitivity increases, and the nervous system stays engaged. Constantly changing speed or pressure can interrupt that buildup. Once you find a rhythm that works, give it time to do its job. The fourth principle is pairing stimulation. Research shows that combining penetration with external stimulation significantly increases orgasm likelihood for many women. This isn't a sign that something is missing. It's simply how the nervous system integrates pleasure. Encouraging her to guide or assist with what feels right creates collaboration, not pressure. And finally, there's communication, not as a performance review, but as shared curiosity. When intimacy feels like exploration rather than evaluation, anxiety drops on both sides. Simple check-ins, body cues, and responsiveness matter far more than verbal instruction. When she feels you're tuned in and adaptable, arousal deepens naturally. Taken together, these principles shift intimacy away from effort and toward alignment. You stop chasing outcomes. She stops feeling pressure, and pleasure becomes something that unfolds rather than something you try to force. And that brings us to the most important perspective of all. If things haven't clicked perfectly yet, take a breath. This isn't a failure, it's understanding. Every woman's body is different, and intimacy isn't about hitting a checklist or chasing a perfect outcome. The real secret is curiosity, communication, and learning how to respond to each other over time. When a woman feels that you're present, attentive, and willing to learn with her, not judge yourself or rush the moment, intimacy deepens naturally, and often, pleasure follows. Before we wrap up, I want to touch on something many of you ask me about privately: what actually helps men feel more confident, capable, and grounded in their bodies as they age. After reviewing the research and working with men for years, I've narrowed it down to 4 natural essentials. One that supports erections, one for stamina and performance, one for testosterone balance, and one for prostate comfort. They're science-backed and designed to work together. You'll find them linked in the description and pinned comment if you want to learn more. And remember, this channel is a safe space. Men supporting men without ego or embarrassment. If this video helped you, share your age and where you're watching from in the comments. You're not alone in this. As men get older, intimacy doesn't have to fade. It evolves into something more intentional, more connected, and often more satisfying than before. I'm Dr. Aria Brooks, and I'll see you in the next video.